Hey, my name is Dr. Cozy. It's really nice to meet you. Really quickly, can I get you to verify for me your name and date of birth? Okay, perfect. And do you know today's date? Okay. And do you know where you are? Good, okay. So, I see you were in an accident and you cut up your ears pretty good. Yeah, you did. Okay. That looks uncomfortable. What happened? Okay. That's unfortunate. I'm sorry. Are you having any dizziness, any nausea or vomiting? How about any ringing in your ears? Okay. Any diminished hearing at all? How about any visual changes such as blurry vision, double vision, any kind of dark spots, or anything that doesn't quite seem right? Okay. Any migraine aura? How about any numbness either in your face, ears, extending down the neck, shoulder? And so they're currently painful. Could you rate that pain level for me on a scale of 1 to 10? 1 being nothing, 10 being excruciating, like you're going to pass out? Okay. And do you know when your last tetanus shot was? Okay. Okay, then let me just check your allergies. Okay, so this shows that the only allergy you have is to carrots. That's different. So just to verify, there's no antibiotic or medication allergies, and no allergies to iodine. Okay, just need to check. I am going to take a close-up look at your ears in just a moment here. There is a possibility of needing antibiotics, but first I'm going to do a couple of tests just to make sure that your brain is okay, and then I'll take a look at your ears and can assess whether or not antibiotics might be warranted if there's a risk of infection. But first we gotta check out your brain, okay? So if you don't mind directing your gaze right here in between my eyebrows. Thank you. Good. Okay. Continue directing your gaze right here. Let me know when you see my light enter your field of vision. Okay. And same thing, other side. Alright. And now, without turning your head at all, I'd just like you to follow my light, just using your eyes. Great. gonna check your airway here. Can you open for me? Great, thank you. Okay. And one more thing here. I'm just gonna listen to your chest, if that's okay. You can just breathe normally here to start. Okay, so now if you can take a deep breath in for me. And out. Good. And again, deep breath in. And out. Again. And one more time. Okay. Any pain or discomfort, dizziness with those deep breaths? Okay, good. Are you feeling pain anywhere else on your body? Just the ears, okay. Do you think there's a chance that you may have injured somewhere else and you're just not aware? Okay, that's fine. We just need to rule that out. So, okay, so your pupils were dilating normally. They're equal, which is good. You're able to track the light without any issue. Airway is clear and your chest is clear. So, I'm gonna go ahead and take a look at your ears here. And I do need to look inside them. If this is too much for you though, if it's too painful, I can go ahead and numb you first. Do you want to try? Okay. So, it's absolutely fine if you need numbing. Okay, so it's uncomfortable but not, okay. Not seeing any kind of internal damage here. The tympanic membrane appears intact. Not seeing any redness or swelling or other sign of irritation. going to remove my cover and just take a look here at the ear. Yeah, that's going to need some sutures. Same thing on this side. Okay. And it does look like there is some debris inside of the lacerations on both sides, so we're going to need to clean them out as well. Really quickly, let's see what you're able to tolerate. So if I tap on your ear very lightly, too much. Okay, how about? Okay, and let's get you numbed up real quick here. It's important that we get these clean, but not at the expense of your comfort. So I'm gonna use some lidocaine. And this does take a few minutes to kick in. But then it should get you really nice and numb and you won't feel anything. So, okay. The first injection you'll feel obviously the poke, and then you're going to feel kind of a burning sensation as the medication enters the skin. I recommend focusing on your breathing to start, okay? So let's just take a deep breath in together and out. Okay, so I'm going to stand up here and I'm going to take a deep breath in and hold it. Okay, and out. Good. Doing great. It's already getting nice and pleasant. Good. Remove that little bandage in just a moment here. Now we're going to do the other side. So if I can have you take a deep breath in again. Good. And exhale. Good. gonna remove this little bandage here, if that's okay. Just want to be able to get these completely clean, and Band-Aids can hold on to bacteria when they've been used, so it's going to take a couple of minutes for those to completely numb. I don't want to begin anything until we have you numb, okay? So while we wait, I'm just going to take a look at your chart and write some notes. Okay, so let's see here. Really quickly before we begin, just to give this a little bit more time to kick in, I'm going to do a quick hearing test. So I'm going to place my hands on either side, and I just want you to tell me which side you hear my fingers. Okay. Good. 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 Let's test. So, can you feel that? How about that? Okay, so then there. There. Okay, then it looks like we can begin. So we're going to start with some irrigation. And this just has some normal saline inside of it, okay? so it's not going to sting. You might feel a little bit of pressure, but that should be the extent of what you feel. So, okay. You ready? Okay. All right. So I'm going to go in with this little forceps, just because I see a couple pieces that need a little bit more hands-on to remove. Doing okay? and disinfect with some iodine. I'm going to use a scissor actually for this. Just because it's perforated does not always mean that it tears apart easily. So and for whatever reason this one is really stuck. There we go. Okay. So this stand up. Alright. And I'm going to change my gloves here. First I need to let my hands dry a little bit because they get a bit sweaty with the gloves. Let me do something real quick. I'm going to take a quick measurement of each of the lacerations here. That's a big one. So, judging by the looks of it, I don't think you're going to need any kind of IV antibiotics, but I am going to prescribe for you a broad spectrum antibiotic, something probably like Augmentin, amoxicillin, just to cover for any kind of bacteria that may have entered the ear. The iodine should have done a pretty good job of disinfecting, but we like to make sure that we cover all of our bases, okay? Okay. Let me get some gloves back on here. So, if you want to close your eyes, it's totally okay and understandable. And if you want to watch, well, from what you're able to see anyway, that is okay too. I like to watch these things, but that's probably because it's also my job. So, okay. Oops. I'm going to start. So first I'm just going to press lightly with my tweezers. Can you feel that? How about there? Okay. And there. Good, okay. Then we're going to start. So you're going to feel some pressure, maybe some kind of pulling, but you should not feel pain. If at any point you do feel pain, please let me know. We'll make sure to get you a little bit more numb, okay? Okay. great. Feeling okay? I think we're good with just 3 on that side. First of all, can you feel that? How about there? And there? Okay, good. do one more. Great. Okay. So we have 4 on this side, 3 on the other. Now, let's go ahead and get some antibiotic ointment on those ears and then get them bandaged. So, I'm going to probably have to get creative with how we bandage these so they're not completely covering the ear. I would like you to coat these with some antibiotic ointment once a day. But there's a star next to that when you change your bandage. However, if you end up needing to change your bandage more than once, like for example, you're taking a shower and happen to get the area wet, then you can recoat it again, but I wouldn't coat it more than twice a day. We don't want the skin getting too macerated, which is kind of that like pruny effect that happens like when you take a bath. If you start noticing that happening, then just take a break from the ointment, okay, until you notice that going away. If it doesn't go away, then I want you to come back in here and we will reevaluate you. It's not so much an infection risk as it is the risk of it just not closing properly. But bacteria does like a moist environment. Let's cut this. That should fit. Okay. That's comfortable? Okay. I'm going to put a little tape just to keep it closed. Perfect. All right. So, let me just document here. And then actually really quickly, let me check. Okay, so your pharmacy is Walgreens. Is that where you'd like me to call in the antibiotic? Okay, so I'm going to prescribe you Augmentin. And I want you to take it twice a day for 7 days. It is very important that you take the complete prescription, even if you're feeling okay. And don't miss a dose, all right? It should not upset your natural gut biome, but if you start having some side effects, GI side effects, then it's okay to take a probiotic. You'll want to take that first thing in the morning, and then take the Augmentin. And people do generally tolerate it better when they take it with food, okay? Okay. So, say generic is fine. So I wrote up some quick notes that I will be handing off to one of my nurses so they can type off some discharge instructions. They will also have some pamphlets to provide you in terms of how to properly take care of the lacerations, how to change the bandages step by step, and as well as any kind of warning signs to look out for. Okay? Okay. So important things to be on the lookout for, which would indicate you needing to come back here right away. Any kind of fever or chills, nausea or vomiting. If the wound sites turn a bright angry red, or you start seeing red streaking or spreading out from the ears to the face, down the neck, or behind, and you'll want to check to make sure that you see that, okay? You can use like a compact mirror. Any kind of drainage that is not blood or clear serous drainage, that's okay. If you're starting seeing yellow, green, brown, we want you to come back in right away. Any kind of increased swelling, any change in your ability to hear, ringing in your ears, whooshing in your ears, popping or crackling when you swallow, or if you develop a sore throat, I would like you to come back in right away so we can reassess you, okay? Okay. That will also be in the discharge paperwork that you'll be given. So, I would like you to sit in here for about the next hour for observation, just because you weren't sure if you hit your head. Sometimes because of the initial endorphins that come on when we get injured, we're not always immediately aware of our injuries. So this way, if you start feeling something else or something's not right, you'll be here where we're able to help you right away. Okay? There's a call button right here that you can push. See the little icon that has the little nurse on it? That will ring the nurse's station and someone will come in to help you right away. Okay? Okay. And I will still be rounding in the emergency department, so if you need me, you can just have a nurse come and grab me, or I can be paged if for some reason I'm elsewhere. Okay. Do you have any questions for me? Well, if that changes, feel free to push that button and have one of our nurses know. And while you're here, someone will come in here every few minutes and check on you and make sure that you're okay. Okay? All right. So then I do want to see you back here in 7 days, so that way we can remove those sutures from you and reassess your wounds, making sure that they are closing appropriately and that there's no issues. All right? Okay, great. Well, it was nice to meet you, and I'm sorry it was under these circumstances, but we'll get you all taken care of, okay?